Hello, I'm John Kanalopoulos, an eye surgeon based in Athens, Greece and New York City, New York. I'm very excited to present to you our homemade technique of Athens protocol. This is the combination of a topography-guided partial PRK, which aims into normalize very irregular corneas and collagen cross-linking, higher fluence collagen cross-linking. We have pioneered this technique in the treatment of progressive keratoconus and post-LASIK ectasia, and we have seen that this technique may be also extremely helpful in significant cornea scars. You'll see a video describing a case with a very significant cornea scar, candidate for penetrating keratoplasty, that we tackled with this approach, a topography-guided normalization of the surface and then collagen cross-linking that aims not only to stabilize the thinner cornea after the laser ablation, but also with its work on cornea keratocytes to reduce the amount of scarring. I hope you find this presentation interesting. At the end of the presentation, I've included slides of our published results on this in clinical ophthalmology, and I thank you very much for your attention. This is the case, significant corneal scarring from a serious infection from contact lens use. You can see the dense scarring in the cornea. On corneal CT here, you can see this is deep anterior stromal scarring, candidate for lamellar keratoplasty or perhaps penetrating keratoplasty. And here, the extremely irregular pentacam maps. Again, very regular surface keratometries up to 54, as you can see, and 30 on the same cornea. This is the wave-light topography-guided ablation profile. This is again the cornea in surgery. We will use the EX500 laser from the Alcon refractive suite. It comprises of the FS200 femto, and here is the EX500 PTK mode, removing the epithelium with PTK, as you can see here. A very good tracker on the EX500 laser and online pachymetry measurements. So we'll remove the epithelium with PTK in order to address the possible irregular thickness that nature has made over this extremely irregular cornea. This is real time, the PTK mode, and then we'll go on to the topography guided ablation, which is a very irregular ablation, as you will see in a few seconds. Again, this treatment is performed with the Alcon EX500 excimer laser, and it gives us the ability to monitor in real time online the actual corneal pachymetry. So I will show you once again here the topography-guided partial PRK, which aims to normalize this very highly regular cornea. And we're back after the PTK performing this topography-guided PRK. The images here are placido disc-generated images with a Vario topolizer by Wavelight Alcon. And reason for that is that the pentacam maps are not reproducible in scars of the cornea. We're using mitomycin C here, 0.02 milligrams per ml. For a full 40 seconds. I'm glad I draw your attention to that. So 40 seconds of 0.02 milligrams per ml of mitomycin C in order to avoid scarring. And of course, as I mentioned previously, the main chill BSS here, the main weapon in reducing scarring is the smoothing of the cornea stromal irregularities and the collagen cross-linking, which will take place now. This is 0.1% riboflavin sodium phosphate solution. We do not use the dextran diluted riboflavin. So same concentration, 0.1%, but sodium phosphate. And then we'll use the Avidro device, the KXL Avidro device, you'll see momentarily here, set at 10 milliwatts fluence. We have pioneered the use of higher fluence in collagen cross-linking, and here positioned over the patient for a total of 10 minutes. So 10 milliwatts for 10 minutes. This is the patient several months later. You can appreciate how the scarring is gone. There's clinical signs of collagen cross-linking evident within the corneal stroma. And this is the change before and after the corneal OCTs afterwards, showing deep cross-linking and a much smoother surface. And these are the pentacams post-operatively. Still irregular, but as you can see here, compared left before and right after, a much improved regularity, visual acuity, best corrected now to 2025. This is a publication in clinical ophthalmology showing another case, bilateral significant cornea scar before and after. And I thank you very much for your attention.